I discuss about the pathophysiology of the stroke. What is the stroke? Stroke are the stage or condition where the blood supply in the brain is stopped. It is maybe two reasons: if the rupture of the blood vessels or blockage of the blood vessels during the passing of the blood from one person to other person. Next, the rupturing and without after the blood passes are restricted by the clot, that is known as ischemic stroke. And if the blood is not passes from one portion to other portion of the brain, it means those area blood are not supplied, their deficiency of oxygen occur, and after 1 or 2 minutes, within a minute, the cells of the brain will be died. That induce the stroke, and ultimately patient is going to paralyze. Oh, okay. And on the basis of their stroke, it is divided into three type of the stroke. First is the transient ischemic attack. It involves the blood clot, but it may be reversible. Second is the ischemic stroke. It involves the blockage in the blood vessels and are clot in the blood vessels and blood are restricted to passes. Okay. And third is hemorrhage. It means either the burst of the blood vessels or leakage of the blood vessels. Next, it can be discussed about the stroke by the help of diagram. This is the brain, and hemorrhage stroke, weakened disease in blood vessel rupture. This is the blood vessels, blood leakage into the brain tissues that induce the clot of the sub area of the blood where leakage occur by the blood vessels. That induces the hemorrhagic stroke. That is called as hemorrhagic stroke. And secondly, the ischemic stroke. It means clot occur in the blood vessels inside of the brain, then restricted to pass of the blood. Ultimately, they induce the ischemic stroke. Next, and sign of symptom. After the stroke, the paralysis occur, weaken in arm, face, and legs, one side of the body, and trouble speaking, understanding, and confusion, orientation, lack of responsiveness, and sudden behavior changes, especially increase the agitations. And vision problem, trouble in seeing, and one or both eyes, sign vision, and trouble in the walking, loss of balance of the coordinations. Ultimately, the severe sudden the headache, maybe occur seizure, and this is the common symptom of nausea and vomiting also. Next, the risk of the strokes, the diet. Unbalanced diet means risk increase the high risk of the salt saturated fat. If the salt and saturated fat is a high level in the body, that may induce the clot in the blood vessel inside of the brain. On the basis of this clotting, the ischemic stroke are induced. So it means the diet should be healthy, not have the more content of the saturated fat and salt. And inactiveness, poor lifestyle, inactiveness. Those person having the inactive, it means less routine was exercise are doing in the life. Ultimately, the blood flow reduces, and may poor lifestyle the risk of the strokes. And heavy alcohol, those persons using high alcohol regular basis, then increase the risk of stroke. Family histories, stroke, high in family histories, may be either genetic factors such as the high blood pressure, and age factor also involved in a stroke. High age, older person have the more risk of the strokes. Next, the health history. The condition of stroke involve previous stroke, high blood pressure, high cholesterol, carrying the high weight, and the disorder, coronary artery disease, heart valve defect, enlargement of the heart chambers.